back home.
What about the cost, Alera? In terms of costs, is it affordable?
It depends on how you define affordable. It is not free. It is not being run, the government didn't put it there to make a profit, but it is being run to generate, to be self-sustaining.
To look after itself.
Yes.
Okay.
And one of the problems we have is 99% of the consumables we buy are made abroad. And medical care does not have access to foreign exchange at the CBN rates. So we have to go and change money on the black market and buy things for twice the price they should be. So we have that problem as well.
But even with the new policy, you still don't have access to foreign exchange at CBN rate?
No, not that I'm aware of, and not that most doctors are aware of, no.
Okay. Since you started clinicals in 2016, has there been any landmark incident? Or should I say landmark?
Certainly.
Okay.
Yes, in December, well, you know, in medical care, when you say landmark, it's not really good news. But in December, there was a church collapse, which...
Oh, yes. We all heard about that.
Yes, and majority of the very ill patients were brought to the hospital. Now, before then, and that was a big event for us because it completely overwhelmed our usual status quo. And we were not expecting that number of patients. So we had to take care of about 100 patients that we had to admit. Our doctors were working around the clock 24/7. When all that happened, I knew we couldn't handle this with the services we had. I called the governor. I said, we're in trouble, we need help. He organized the logistics. We brought several neurosurgeons and orthopedic surgeons from around the country, especially Lagos and Abuja. The governor arranged transport for all of them. They all came in, and the teams worked together 24/7 for about a week. We did over 30 neurosurgeries and about 40 to 50 orthopedic cases. And there's some dramatic cases from that. Somebody who was paralyzed from the neck down, not able to walk, and things like that. So that was a landmark experience for us, and it taught us a lot.
Okay. When you started, you said that things were changing in your sector. I was talking to a medical doctor only on Sunday, and she was telling me that she didn't want to work in any hospital. She only wanted to concentrate on public health because the hospitals just didn't have any equipment. As they said, sometimes she worked in a hospital during her youth service, there was no water to even wash her hands. And in a hospital, I mean, come on. So do you see, when you say that things are improving, are you looking at a crystal ball? Or why do you say that when we know that in many public hospitals, things are really getting from bad to worse?
Well, I'm not so sure I agree with that completely. Things are bad. You can't separate healthcare from the country. We are part of the country. We're part of the recession. We are part of the lack of infrastructure. That is all there. But if you look carefully, especially in the private sector, there are centers of excellence all around the country. There are centers of excellence. Open heart surgery is going on. My specialty, angioplasty stenting, is going on. We're putting in pacemakers.
What's
Angioplastic stenting.
That's what we call
a plastic surgery.
Plastic surgery.
Like keyhole surgery of the heart, where you open up blockages in the heart without cutting the patient open. You go through small tubes.
That's your specialty.
Yes.
And you are operating in Nigeria.
Yes. So when people say things are horrible, it's not really that bad. I mean,
now
it can improve. It can improve, but there are several facets of healthcare. The lady who talked about public health is important. We need insurance. Many of the people cannot afford the healthcare. The government hospitals are overwhelmed. They're just simply overwhelmed with patients who can't pay. So a lot of things have to be done. But in the private sector, things are moving because a lot of people can pay for those services. Anybody who has a job generally has insurance. So that helps. But what's important is how to get everybody insured, or a healthcare system where people have access to care. There is care, not everybody has access to it.
So going forward, how would things be?
Is that a general question about Nigeria healthcare or IBOM specialty?
IBOM
hospital?
specialist in relation to the Nigerian
Okay,
healthcare
with
system.
IBOM Specialty Hospital, multi-specialty hospital, I can tell you every month there's a new specialty added. And right now I said we do neurosurgery, cardiology. We are starting open heart surgery in a couple of months. So that's going to be a big deal. And I can tell you we'll start kidney transplant by next year. And I will say for 90% of healthcare, you will not need to go abroad.
By next year?
By next year, yes.
What time next year? Is it end of next year, mid next year, beginning of next year? What
Let's
time?
leave it at next year.
Very open-ended. I suppose that's safe.
Yeah, I think that's safe, yes.
Okay.
Okay.
All right then. So all we can do is wish you good luck.
Oh,
and
what's up? Hold on, before we let him go, how do you get access there? I mean, someone has an emergency. Do you have an air ambulance, or do you have a helipad? Or none of
Okay,
that?
that's a very good question. I can tell you, wherever you are in Nigeria, you can get to Uyo much quicker than you can get to India. It is a 50-minute flight from Lagos, 50-minute flight from Abuja. It is 2 hours drive from Port Harcourt. So it is easily accessible. We have a helipad, and there are air ambulance services in the country that can bring you here.
Contact details.
Contact details, I left them out there.
A phone number?
Yes,
or
I gave them the phone numbers and all. I don't have them all.
Okay.
Okay, the
Get
phone
up,
number is
okay.
on the screen.
Okay.
It's on your
Okay,
screen
so-
right now.
Okay.
Well, we
And
can
if you
do.
just Google IBOM Specialty Hospital, it comes up first.
Well, this is wonderful news for Nigerians. I'm sure that people who are watching this morning will all be excited about this news. We will say congratulations to you all for setting up that kind of facility. And we wish you all the best. That's not saying that we wish Nigerians to fall ill, but you know what I mean. Just in case you do, Akwa Ibom is closer than India or Germany or the United States. Thank you very much for coming.
Thank you.
Dr. Yemi Johnson, who is the Chief Executive Officer, IBOM Multi-Specialty Hospital. Sunrise will be right back with the home stretch in just a moment.